perspective, like these all play an effect in how you're feeling that. So it'll differ. Other than that, say pregnancy helps. You're not seeing, but I'm seeing how to nod like we'll get to pregnancy with but yeah, and that's a whole different situation. But you definitely need to get a check. If you're bleeding during pregnancy, you need to be checked. Yeah, there's a lot of risks for people who are like, no kids, right? There's a lot of risks associated with not having kids, with pregnancy, to a lot of later issues. Just like there are a lot of risks associated with being pregnant too early in life and too older in life. So there is a fine line to reduce risk. I'm not saying like this happens, but there's just be aware that these are associated with increased risk for things. People hear that and then people just like, I gotta have kids at 26. Like, that doesn't mean that. It just means accept the association. It's not a cause, but there's just an association with these things are more frequently occurring in people who have been pregnant at a younger age, like below 21, 22, versus these are associated with people who are pregnant at 38 and plus. People say you should never get high risk, and so people have no issue being pregnant at 39, 40. So it's not a sentence, but it is a risk nonetheless. What's that?
Never gets their period ever.
Now again, you need to see no, I don't know.
Like great knowledge. Never got her period. She was 95. What possibility? Because she's not. That's why she lives at home. That's what women do. They don't have to go. I don't know. Back in those days, like you make
The last one. Last one. Alright, so these are terms that we should be familiar with, okay? Perimenopause, menopause, and postmenopause, okay? Perimenopause is a transitional period, approximately 4 years that precedes, that means before menopause. Hormonal imbalance occurs as ovarian function declines. Ova slowly diminishes, the menstrual cycle can be anovulatory, which can lead to irregular bleeding. Menopause, also known as the change of life, is the cessation of menses for at least 12 months that occurs during 41 to 59 years of age. Menses will appear on an infrequent cycle and the flow will decrease until there is complete cessation. Okay, the client can have natural or surgically induced menopause. This is because you can have your ovaries, your uterus removed. So then you don't have menses for 12 months and it's surgically induced. Or naturally, it just happens. Okay? Postmenopause means they have been cessation of menses for more than 1 year. So perimenopause, it can start when you start seeing infrequency. Okay? It's already infrequency and there could eventually be cessation. Now, I think these terms are important because sometimes you can hear women say like, I'm going through menopause. That's perimenopause, that's what they're referring to. Like they may be initiated, they can see differences, whatnot. This does not mean they cannot get pregnant. Okay? This is how 50-year-olds wind up pregnant. Okay? Because they're like, I'm going to menopause, it's cool. And then boom. Okay? So, until there's been complete cessation, it's not impossible. It's not just unlikely. How's that? Through the peri. Once you've been post-menopause, ideally, again, not impossible, unlikely beyond belief. I say that, okay, I say that because you gotta watch the terminology, and I see doctors do it all the time. People say, so I can't have it. They're like, unlikely. Yeah, because they can't assure you, because anything is,
Miracles can happen.
technically it's possible. It's just, but when they say not happening, it's 99.9%,
0.99.
like this is not gonna happen.
No 100%.
And I'll have that proven to you what happened to me on the weekend.
Who did you get pregnant? What old woman did you get pregnant?
My cousin's an idiot, and I don't know how or why he has ear pain. So he told me, he's like, I'm in this, I forgot what the hell he said, I'm in the ER, and I was like, is everything okay? He's like, I came for ear pain. And I was like, okay. And I was like, you might have an ear infection, you know? He's like, but it's been like on and off. And so then he's like, I think, he said, it's an eraser that's been stuck in my ear since the second grade. He's 25. He's 26.
It was a race.
I was like, bro, that's not, I was like, you would have had issues long ago if there was an eraser stuck in your ear. I said, and he's like, bet $20? And I told him, no. I said, because it could be small enough, you're telling me an eraser, I'm imagining an eraser. I said, but it could be a small piece of eraser. So I said, it could be small, maybe it's just, that's what you have on and off issues. So I told him, no bet. He's like, okay, he's like, I was supposed to go see a specialist, but I never did, so now I'm back in the ER. I said, all right, cool. So, I can show you the text message, so I left him at that, I was like, so you might have an eraser. I mean, I thought this one I'm gonna tell him. Go see a specialist. So I left him on that. He texted me today. I know. So he was there on Saturday. Okay? He was there like he was there yesterday. And it's funny because I told him, I was like, my girlfriend had an ear infection too. On Friday, she went to go see a doctor.
Did she also get an eraser?
No, it was an infection. She saw a doctor, it was an infection. But, he just texted me this. That's all that came in, just a picture.
Okay.
It's the eraser!
That's like what? 15 plus years?
Okay? And he says, it came out. He's like, I've had this eraser in my ear for 18 years. Notice he's not at a doctor's office. He said they gave me some ear drops. He said, and they told me to go see a primary because they have the tools to like get it out. He said, but they just gave me eardrops that's supposed to start softening and getting rid of all the wax around. He's like, because they thought that something was lodged. He's like, so then he said that he's being in an apartment today, and he kept on feeling like this, like itchiness and like moving. And he's like, I'm walking around viewing the apartment, and at the apartment, I felt something come out. And he said that he looked down, and he can see it. He's like in amongst like the gooey wax. I can see the eraser. That's why I took a picture of it at the apartment. 18
Staying for 18 years, I'd say really on drugs.
All right. Last few things we can all break. Last few things. So what to know about perimenopause? All right. Real quick. So what should you know about this, right? So what are we gonna do? I'll tell you the straight up the things that are gonna matter the most. So look at where it says patient-centered care. Okay, provide education with the client about the condition and how to manage it. Inform the clients to report vaginal bleeding. So they can have atrophic vaginitis, it's vaginal burning, vaginal installations, their nutrition. Okay, so it says dyspareunia for vaginal dryness. That's one thing that I need you to know. So expected findings. It's easier for you, sorry. Let me go back to page 440 where it says expected findings. There's a few that I want you to know. 1, hot flashes. You hear that report a lot. Another one, vaginal dryness. Okay, mood swings, decreased sleep, and you can see like a thinning or lessening of vaginal tissue. This makes it more susceptible to infections. Okay. Okay. Now, building on that, go to page 441, you'll see medications. They're gonna take hormone therapy. Now, I want you to put this, right? So it contains estrogen or a mix of estrogen and progesterone. Okay, something that's also gonna happen to them is post-menopause with the lack of estrogen, they'll develop osteoporosis. This is a thinning of your bone. Okay, so write that one down as a complication. You'll see it at the end of the chapter, but I'm telling it to you now because it ties in. So without proper hormone balance, they don't absorb as much calcium. So taking in calcium, vitamin D can help, but again, the problem is the hormonal balance is not there to allow them to absorb it. So they'll develop osteoporosis over time. This is why older women tend to have a lot of fractures. So hormone therapy will help reduce this, is the aim, as well as the symptoms, hot flashes, dizziness, lack of sleep. You can take this right as vaginal creams, PO. Now what I need you to know is causes therefore it says the risk of hormone therapy depends on many factors like their age. But the risk for severe conditions, so risk of hormone therapy. One is cardiovascular disease or accidents, which really means you can develop, more likely to develop blood clots or bleeding disorders. Bleeding. This then in turn relates to stroke, MIs, DVT, and there's an increased risk for breast cancer. Okay. This also, and we'll go more in detail about this in OB, because there is like many pills, which is like estrogen only or progesterone only. There's a mix of them. There's different types of hormone therapies, and some are the risks that we're saying, but as a general, hormone therapy runs these risks. Cardiovascular diseases or accidents like blood clots, strokes, MIs, DVT, bleeding disorders, and breast cancer. So, a lot of the questions are, who are not candidates to receive hormone therapy? So, because of this risk, people who smoke tobacco, nicotine, right, or alcohol are not great candidates for hormone therapy because this only will increase the risk of blood clots, strokes, MIs, DVT. Yes?
The tobacco, I get usually to everyday thing, but for alcohol, does it mean someone drinks like occasionally, or is it like alcohol?
I would say excessively.
So it's not like they have a drink once a month when they go out.
Right. Now, excessively, in case y'all don't know, did we talk about this last week? Right? It was like, I mentioned, usually, you guys know that for the standards, like in the medical field, if you have more than like, I think it's 4 drinks a week for women, and it's like 5 for men. And I made that emphasis, so this is it, by the way. Okay? Just know this, and we'll recap the topics in a little bit today. But this is the risk. Don't give it to people who have or suffer from this. Yes?
What's the first line? Cardiovascular what?
Disease.
Oh, disease.
It's still not a disease. That's a TB.
not your tall can. Okay?
The normal ones or the big ones?
Now I think they made it 5. People are getting savvy, okay? They're like, give me the extra ounce. 1.5, it used to be 2. Yes, it increases the risk. But mainly tobacco smokers.
Okay.
Because as he's pointing out, alcohol varies. Now, we're going over excessive alcohol intake. It said 4 to 5 servings per week, and these are your serving sizes. And I make the joke that it's not the tall can or your 40 ounce. Okay, that's not one. Yeah, no más. It's 1 serving of this, 12 ounces of beer. Now they changed to 5 ounces of wine, and they lowered it to 1.5 ounces of liquor, which is a shot. Okay.
It's like a baby.
So, some people are like, well, I only drink on Saturday. But if you had 7 of these, you got a problem.
If you don't remember that.
I know. You do it every weekend.
Now, I'll give you some life tips and advice so you don't die soon. 1, drinking 7 shots or beers or wine or whatever, 7 servings. If you drink 1 every day, you will live longer as opposed to you drinking the 7 in that one party, especially that one city. This is obvious because alcohol is poison. In short, but it makes you feel good for the moment. But in short, it's poisonous, right? Hence your liver has to process it. So the more you take, right, then the harder your liver has to work. So when you do it quickly, your liver overloads. As opposed to people who drink 7 shots in a week to 7 shots in that sitting, the person who's doing it in one sitting is gonna result with problems faster than the person doing it in the
But I
week.
feel like the 1 shot a day is like more alcoholic. Like, it's like, because I know like someone who's an actual alcoholic.
And signs of this are denial, rationalization, that means sort of you're justifying.
Armando, just come over to like an Armenian wedding. Let's see how many people stop at
So, again, this is by the medical field situation, but it's just that it is, this again is covered in mental health, just because they do ask, and just so you know on your test, when they ask what should you know or assess people for a dependence or substance use, especially alcohol, what's the questionnaire?
How many drinks do you
Oh,
like how
Cage. You give them the Cage questionnaire. Okay, don't forget, that's a common question. What should you know? The patient drinks, blah, 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 they only drink on the weekends. So instead ask them the Cage questionnaire. 4 questions, if you answer yes to at least 2 of them. I think, I forgot it. Do you feel guilt? Do you feel guilt? Do you feel annoyed that somebody has told you something? Huh?
Is your partner bothered by your guilt?
Yeah.
No, have you ever felt the need to cut down?
Cut down. You felt the need to cut down? You feel annoyed for people telling you about your drinking?
Feel guilty?
Guilty after drinking?
Or an eye opener in the morning to relieve the shakes?
Yeah, you need to drink in the morning.
I have never heard of it.
If you ever woken up and you drink another beer to feel better,
It works. It works.
Wait, do you
It helps you burn my
did I drink another
I know you did for a fact.
So, because enough people see me tired and they always say, oh, you were at a party. I do not drink alcohol. I used to drink alcohol. I have drank alcohol. I did still drink when I wasn't there.
Yeah, 'cause I'm like, I remember you were drinking.
But I was already not drinking when I did my RN program, so.
Did you ever drink for locals?
Huh?
Did you ever drink for locals when it was good?
When it was good, when it really killed you? Yeah.
Now it's too weak.
I drank about a quarter of a can when I was like 21, 18. And I never again, because it is the most disgusting hangover you could possibly have.
What is?
It's called Four Locos. It's still around. So, Cage questionnaire, 4 to 5 surveys per week, and it is serious. Now, before I let you go, I'll tell you the last story. I don't think I told you guys. 2 weeks ago now, it's been 2, 3 weeks, because I didn't have you guys yet. I told the other intern 4. I usually tell you guys or like point out little highlights of my day my days at the hospital from that week, like a little highlight. So 2 days ago, I had not 2 days, 2 weeks ago, or 3. I had my highlight was that there was a code. Now, in this unit, the teamwork is pretty good, and generally we see things coming and they get dealt with differently. So rapid response is usually called and they come down and assess and do what they need to do. But a code, or like a true code, like person, like are you gonna perform something or anything, it's more rare, because I feel like again, rapid comes in way before. Nurses are more on top of their stuff in the unit that I'm on now. And so, they called, so I was like prepping for my meds, I was putting the last things in my cart by the med room, and usually you hear it, right? Because they call the operator will announce it to the hospital wide, so you hear it. So I didn't know if I heard it correctly when I just heard the charge, I heard the charge from the station, from around the corner from the station yell, like, grab the crash cart to 552. And I was like, what? And then like I turned around, and when I turned, she had peeked down the hall to see if anybody was there. So she let me know directly, she's like, grab the crash cart at 552. So I saw what I was doing, and I went to go grab the crash cart, and like, we started hauling, and then another person saw me, and we started like putting it together. And we got there, and there was an isolation, and I was like, what's the item? I was like, oh my God, we need isolation. But then some people run in, so instinctually I did too, just because I trusted them. I shouldn't have done this, but I did. So I didn't get up anymore, we just put in, and immediately they lowered the bed, and like, cause when I walked in, he was, they're like Dunzo, right, like out. They lowered the bed, and she hopped on, she immediately started like doing compressions, so they already had said they had no pulse, so I could put like a full blown coat. I hadn't seen one in years, okay, like I don't know what I've been doing in my life. I haven't been involved actively in a code probably easy in a couple of years. So I was like, it caught me, like, I'm not gonna lie, I was a little shook. I still remember my first code to this day. It was my patient. And so this one wasn't my patient, it was another girl's patient. So she hops on, right, starts doing compressions. I started grabbing the pads out, and when somebody took over, I started putting on the pads, so doing some blood sugars. People are doing this, Rapid's on the way now, and blah, and all this, and it's putting the backboard. It was like a whole ass like movie scene, like in the sense, because I'll tell you the one thing that made it like a movie scene, like the mom was there. She's the one who alerted that something was wrong, like he like went unresponsive. So as I show up with the crash cart trying to come in, she's being dragged out by the CNA, right, like screaming like in Spanish, right, like my son, like please, and like she's like being dragged down with her shrill thing, and like we're there, and he's just like, right, and so it was like crazy. So I would start doing all that. Critical shows up, and I promise you, in my mind, I heard 54-year-old male, cirrhosis, blah, blah, encephalopathy. She's just kind of giving a report. I take his blood sugar, and it just read low. You know, when it's so low, it's just low. So then he has one IV access, he would move a lot. So they had him restrained prior because of the fact that he would move a lot and stuff, so he only had one access. Now he's limp at this point, so when the time the RT to the rapid response came, they started just IO lines, which went into the bone, so into like his legs. So they started 2 lines, started pushing D50, bicarbonate, they're doing compressions, eventually fill a pulse, and then starting to transport him, and blah, blah. Now in my mind, I was like, 54, he don't look 54, right? He looked young. And that's his mom, I was like, his mom looks 50. And so then, and seeing him, and so then I overheard in the clarification, he was not 59 years old, he was 29 years old, is what I heard. And this guy was there because he was liver cirrhosis from excessive drinking. Yellow eyes, skin, he was, like my skin's a little bit on the darker side, but you can start seeing the yellow on his skin, but his eyes especially was sclera. yellow. Drank himself to that point at 29 years of age. I didn't check anymore. That was my last day of the, so he lived there. They got the pulse back and he got transported to ICU. I think I overheard the house who said that and just telling you from that, when it's that bad, like how he's going down, everything's just shutting down now from like the cirrhosis, even if he lived through that day, through that code, he's not gonna live long without a transplant. I'm talking about days with how bad he was. Like he's gonna die. Yeah. Like your liver's failing, like it's done. You're not gonna live long without a liver. So once there's cirrhosis, you say goodbye. And because if it happens because of drinking, your transplant list is probably like 30 years. And you're like the last.